Hello, my name is Elena. Thank you for joining me today. Today, I'd like to take you through some information about how to keep your back healthy and the 6 steps to posture improvement. So we'll start with an introduction. Your posture and the health of your spine can dictate your quality of life and overall well-being. There is an ancient yogi saying, "You are only as young and as healthy as your spine is strong and supple." A locked-in, hunched-over posture can contribute to pain, breathing difficulties, depression and anxiety, and increased mortality. In a normal posture, it has 2 primary curves, the thoracic and sacral curve, and 2 secondary curves, the cervical and lumbar curve. These curves act like a shock absorber as you navigate gravity throughout your daily activities. In a normal posture, the pelvis, indicated in a red block here, is in a neutral position and forms the foundation of the spine. Above the pelvis, indicated in the green shape, is the upper spine, chest, and shoulders, and the head, indicated in blue, balances comfortably on the top. In a well-aligned posture, the ears line up with the shoulders line up with the hips, and the hips line up with the ankles. This natural alignment evenly distributes the pull of gravity between all parts of the body. Your habits will form the shape of your spine and body. If you're sitting slouched at a desk all day or stooped over your cell phone or tablet, over time your body will adapt to the shape you are sitting or standing in. Soft tissues, which are muscles, tendons, ligaments, and fascia, may become short or overstretched, and tight or weak, depending on where they are working harder or not working in relation to your habits. In other words, the body will lock in a new posture to compensate for your habits. So this is usually what can cause a poor posture, which in turn can cause incidents of back pain. There are some general guidelines you can use to assess your own posture. However, if you would like a full professional assessment, have someone like your doctor or a chiropractor or physiotherapist do a full assessment of your posture. So to see if your pelvis is horizontally aligned, put your thumbs on your hip bones. They should line up. To see if you have a forward or backward tilt of the pelvis, put your thumbs on your hip bones and index fingers on the pubic bones. They should be more or less in the same vertical plane. So you can try this standing up, or you can try this while you're laying down, perhaps with the knees bent and the soles of the feet on the mat. Another thing you can do is stand with your back against the corner of a wall, with the heels about an inch away and your sacrum making contact with the wall. Your sacrum is this triangular shaped bones at the base of your spine. So place your head back against the wall. If it requires some effort to get your head back, you may have some degree of rounded shoulders and forward head posture. Notice if the chin is jutting upwards when you bring the head against the wall. Place the 4 fingers of your hand behind your low back and notice the space. If the space is much larger than that, then you may have a hyperlordotic curve. If your back is flat to the wall, then you may have a flat back posture, and we're going to go through these postures coming up. In all of these postures, you can see that the pelvis is displaced and the spinal curves have changed to compensate. Note that the alignment of the feet, ankles, and knees also affect postural alignment. So some of the common postural misalignments, this is probably the most common, which is a forward head posture. In a forward head posture, the ears are coming forward of the shoulders, and this can develop into a hyperkyphosis or a rounded upper back. So you can see here on the left is the normal spine, and on the right is the spine moving in a forward head posture. In a kyphotic posture, the thoracic spine or the upper spine is rounded forward in an exaggerated kyphosis. This also shifts the head forward of the plumb line and forward of the shoulders. So you may experience both a kyphotic and forward head posture. In a lordotic posture, this is kind of an arch in the back. So the pelvis is tilted forward in an anterior pelvic tilt, and the lumbar spine is hyperextended or hyperlordotic. In a flat back, the lumbar curve is flattened and the pelvis is in a posterior or a backwards tilt. And in a sway back posture, the pelvis tends to lean forward of the plumb line and forward of the knees. And this can also create a bit of a thoracic kyphosis as well. You'll see a lot of guys that stand this way. I notice it anyway. A lot of guys tend to stand with their hips forward. And in the anterior pelvic tilt, the lordotic posture is more common in women. And then a military posture is where the shoulders are usually retracted back and the chest is lifted. Fortunately, there are ways and things you can do to improve your posture, and yoga is one of them. You need to become aware of how you hold your body in space. Muscles need to be both strong and flexible to support new postural habits. So you need to strengthen areas of weakness and lengthen areas of tightness. Unfortunately, as I said, a well-rounded yoga practice provides this holistic approach through body awareness, strength and flexibility, and connection to the mind-body. 6 steps to a healthier back or to improving your posture would be body awareness, stretch, strengthen, lengthen, revitalize, realign, or reshape. The first step to improving your posture to a healthier back is to become more aware of how you hold your body in space and how you move your body. This is called proprioception. So try this. Hold one hand out in front of you with the thumb pointing up. With your other hand, place your index finger on your nose. Move your index finger to your thumb. Now try this with your eyes closed and see if you can get your index finger to your thumb or if you missed and how much you missed. Interoception is the ability to feel the subtle sensations of the body. Take a moment now to close your eyes and notice the body. Notice where it connects to the surface beneath you. Notice the temperature and sensation of the air around you. Notice the movement of the breath. When the body compensates for misalignments, you may feel areas of tension and tightness. Chronically tight muscles may lock you into undesirable postural patterns. So the second step to a healthier back or better posture is to increase the flexibility of the muscles that affect your posture. Your spine is supported by a network of core muscles that need to be strong enough to do their job. A weak core can contribute to back pain and postural misalignments. The central components of the core muscles include the diaphragm, the transversus abdominis, the obliques, the pelvic floor, the glutes, the erector spinae, and the multifidus. The rectus abdominis is a superficial muscle that does provide some support, but its main function is to flex the torso. This is the muscle group that creates six-pack abs. Overstrengthening this muscle can actually contribute to a tight and collapsing front body. So step 3 is to strengthen the core. As you age, you are most likely going to lose height due to the constant pull of gravity and your postural habits. Although a small amount of height loss is of no concern, significant height loss can contribute to greater health risks. Step 4 is to lengthen your spine. This is called axial extension. Step 5 focuses on hydrating the spine and surrounding muscles and connective tissues. As you age, the cells and connective tissues tend to dry out and may become stiff and sore. You may have noticed this when you get up in the morning, but once you start moving around, you tend to feel much better. The spine is meant to move in all different directions: forward bend, a back bend, side bending left and right, rotate left and right, and axial extension. Moving the spine creates a natural fluid to flow in and between and around all areas of movement. The central nervous system runs through your spinal cord to all parts of the body. This movement helps to create a healthy spine, which allows for a healthy energy flow through this system. The position and balance of your spine relies on the support network of muscles and connective tissues. The body is continually reshaping itself to support the patterns you use. As the soft tissues strengthen where they are weak and lengthen where they are tight, you will find more adequate support in promoting a healthy posture and therefore a healthier back and possibly less pain or even no more incidences of pain. So in step 6, you will explore your shape in relation to different planes of gravity. And this is the conclusion of our short webinar. This is a mini course based on my live, online, or sometimes in-person Yoga for a Healthy Back program. So next you will have some mini versions of the practices to go through. So please feel free to reach out to me if you have any questions or comments on this program, or if you'd like to know when I'll be running this live again. So thank you so much for joining me. I'm so glad we found each other. Bye for now.